Hi, and welcome to Health Connections on Cath Television, Los Gatos, Montserrat. I'm Dr. Stuart Manuchehry from the Palo Alto Medical Foundation, Los Gatos Center. Welcome to part 2 of our cardiology shows today. Last time we met with my colleague, Dr. Amin Manuchehry, and we talked a lot about cardiovascular disease. And today, we're going to have the pleasure of more time with Dr. Manuchehry and also get to see him in action. So I hope you'll enjoy the show and look forward to seeing what happens when a cardiologist is checking on someone's heart in the cardiovascular laboratory. So what do you do when you're there in the catheterization? What actually happens to the patient, and how do you know if there's heart disease?
Sure. Yeah, so the patient we have today is a 71-year-old man, history of hypertension, dyslipidemia, type 2 diabetes. He presented to me last month actually with symptoms of exertional chest pain, shortness of breath. We did a stress test which was very abnormal. We brought him for this cardiac catheterization. This was last month. He's back here today because on his other side, the right coronary artery had significant calcification and disease. Basically, there's rock sitting in these areas that's going to require treatment. So what we did was we're performing a staged intervention. So we fixed one side of the heart last month. He's back here today to fix the other side. What does an interventional cardiologist do? Well, it's a procedure that's catheter-based. So, minimally invasive procedures where we use the highway of the body, which is the vasculature, which, the heart, as I mentioned, is a pump that sends blood out to the rest of the body via the vessels. Now, the vessels also go back to the heart. So I can go in any vessel and try to get back to the heart. For us as interventional cardiologists, typically we'll use the groin vessel, we call the femoral artery, or the wrist vessel, we call the radial artery, to get back to the heart. So we can put a long tubing of plastic along with a wire that can thread us back to the heart and inject contrast dye to really look at what's going on in the heart. Are there blockages in vessels when we inject the dye and look under the x-ray? And that can help us understand what's going on and then certainly make management decisions, whether that be going and putting a balloon to open up a blockage and putting a stent, which is basically a metal scaffold that helps keep that blockage open, or deciding that, this patient has multiple blockages or blockages in very high risk areas, in which case we might say, this is not the role for an interventional cardiologist, and we should decide perhaps surgical bypass is the correct route of management. So, we work closely with our surgical colleagues to help, provide the best care we can for our patients. Certainly patients want to avoid a surgery if possible, but from our standpoint, we want to make sure we're making the right decision and looking for, both short-term and long-term benefit. Sometimes that may be with a stent, and sometimes that may be with bypass surgery. And that decision is made in conjunction with our surgical colleagues and certainly the internist discussing what is best for the patient. So you can see here in the right coronary artery, there's an area in the proximal portion and the mid portion. There's some calcification. The lumen is very narrow up here and here, so we'll fix both of these spots. Otherwise, the vessel looks pretty good size. You want to be more asleep, or are you comfortable? All right. You tell me if you need more medicine. We'll do a rupture. So we just finished the case. Patient's doing well. It turned out to be more challenging than anticipated, but that can happen. We had to change from the wrist access, the radial artery, to the groin access, the femoral artery. And once we did that, we were able to seat our guide catheter better, get our wire down, do the drilling part of the procedure, and now put the stents. Here's one stent we put in the mid-right coronary artery. And then we put another one up in the proximal portion. I'll show you the final pictures here.
Right groin.
So now you can see his vessel looks nice and open. So all that calcium that was causing occlusion has been stented with two stents. So I think he's going to do just fine.